welcome back to another episode of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbir Sayan. Thank you so much, as always, for taking the time to join me here, guys, to learn and to grow. I always appreciate all the support, everything you do to help the podcast grow. It really means a lot to me. We are at the JW Marriott in downtown Vancouver for the BC Doctors of Optometry Conference. When I especially come to the BCDO conference, we see so many great friends and colleagues, and it's always lovely when people are coming up to me and telling me that they listen to the podcast and they appreciated certain episodes. And so if you do get any value out of this, please do share it. Let your friends know, let your family know, put something up on Instagram or LinkedIn, especially this conversation and these series of conversations that we're having on scoped optimization. I think it's very, very important that we all share these conversations so we all know as a collective in BC, across the country, why it's so important for us to continue to optimize our scope and modernize our scope. And if you haven't heard already, we're doing a series of these small segments, 10 minutes, 15-minute conversations with various influential optometrists here in BC who can contribute to this conversation and provide these different perspectives. And on this conversation, I have my good friend, Dr. Shiv Sharma, who is the co-chair of the Government and Professional Affairs Committee. That is the committee tasked with discussing these things with the government and other stakeholders, the importance of scope optimization. He's also a multi-practice owner, and he's a former BCDO board member. So he's been involved with the BCDO and everything that's happening behind the scenes, MSP negotiations and all these types of things in the past. So Shiv really understands, what's happening here and why it's so valuable for us to push these conversations forward. All right, that was a long intro.
Thanks, Harbir.
Thanks for having me.
It's a pleasure to come on, and I'm a big fan of the podcast. So
thanks, man.
Happy to have this important conversation today. I think this is a topic we really need to, as a profession, come together and really put in the groundwork for the advocacy, because we have to get some progress on our scope optimization in this province to really improve the delivery of eye care. Yeah, excellent. Well, thanks for coming on. A returning guest as well, right? It's been a little while now, year and a half or almost close to 2 years. We did that interview. Has it been that long? Something like that. It was a fun one.
It was a good one. That was actually a lively conversation. That one got a lot of hits because we were talking a bit about the profession and certain entities in the profession and how practice modalities and things. I don't want to go too much into that right now, but we got a lot of hits on that one. And we got some positive and negative feedback, which is actually usually a good thing. Tells you people are paying attention. All right, but let's stay on track. We want to talk about scope optimization. All right, we're careful not to use the word scope expansion. It's not that it's a wrong term. It is expanding scope, but scope expansion tends to have a bit of a negative connotation, right? So optimization is a really good word, but modernization, we're behind, right? I know we have some things we want to talk about, but just touch on that for a second.
Yeah, I think, when we say optimization, I like that term because, in a sense, we really need to optimize the healthcare system. It goes beyond just the delivery of eye care. Our healthcare system across Canada and in BC, it needs to really be as efficient as possible with the existing constraints, whether it's family doctor limitations, access to primary care, busy hospitals, long surgical wait lists. This is a place where, really optimizing the delivery of eye care will pay dividends not just for the patients receiving the eye care, but also the rest of the system.
Yeah. So can we elaborate a bit more on where and how we would reduce wait times and reduce that burden on the healthcare system?
I'll give an example of if we had an urgent patient where at the moment, with our current optometrist regulation, we are not legally able to provide the care that patient needs. That patient now has to be referred either to primary care, so family medicine, for example, and other options would be a hospital or an ophthalmologist. And if we look at those three routes that are presented in front of us, they're going to take additional time. 18% of British Columbians don't have a family doctor. And 18%.
Wow.
And of the ones that do, that appointment may take a few weeks to come by. And we know some of those conditions, if we let the patients wait long enough without proper treatment, they could be potentially sight-threatening. In some cases, more serious health complications can occur. So we really want to prevent those patients from falling through the cracks. And I think that's kind of one of the big things that eliminating those unnecessary referral steps would really do, is it would give the patients quick access to, well-trained optometrists that have been doing this across Canada for a long time. It's just a matter of really the government taking action and putting a priority on kind of deficiencies that we have. They really need to be addressed.
Yeah, absolutely. They need to be addressed. And so what is the risk if we are not collectively advocating for this modernization?
I think the risk is just further falling behind. So if we want our citizens of British Columbia to have access to adequate eye care, in terms of, we know the population is going up, we know the demographics are shifting older, there's more need for eye care than the system can currently manage. And if we don't really optimize that, the situation could get worse.
Certainly could.
Yeah. Further falling behind other provinces, it's kind of, it's unfortunate really that other states and provinces in North America, they do benefit from that expanded scope or optimized scope in terms of their patients get quicker access to care. That's appropriate.
Yeah.
So it's really something that we got to prioritize.
Yeah, absolutely. And the advocacy part, I mean, it's on us. Who else is going to do it for us, right? If we're not, each of us, advocating for our profession, it's just, we're not going to get where we want to go. And this is the other thing, is like often on the podcast, I'll say if we don't advocate, if we don't push forward, it's not that we stay status quo. It actually is likely we're going to fall behind, or that our scope may constrict, because there's always other forces encroaching on our so-called territory, right? So we always need to be pushing forward to continue to grow the scope, and we need to be the ones having the conversations. And I know we're going to hear this kind of harp on this, like speak to your MLAs and this kind of thing, but I have met with a couple of our MLAs in our offices, and when I sit down with them and I tell them what we can do, they're amazed, right? Because they don't know. It's nobody's fault. They've just never been educated on it. But the other thing is, when I tell them what the alternative is, like you said, they have to go wait for a couple of weeks to go see their GP, or they go to the ER, or they go wherever. The MLAs are shaking their head like, that doesn't make any sense, right? So they understand it doesn't make sense, but they haven't heard it yet. So that's on us to go and tell them.
Absolutely. And I think, when I've been into legislature, I've talked to MLAs, they're always amazed at, why has this not been done? Like, why are we so far behind? These are things that should have been done 10, 12 years ago.
Right.
And they're very receptive to updating it. It's just a matter of actually putting that into action now. And they're really needs to be some more urgency on Ministry of Health's behalf and on government's behalf to get this done forward.
Yeah. So and it ultimately falls on us to kind of light that fire, right?
Absolutely.
So all of this, as I just kind of mentioned, it's not just staying status quo. There's the risk of us potentially constricting or regressing in some capacity. In some ways, we already have the wrong perception. The public kind of has the wrong perception, or not a complete perception of what optometry does. And that is that we're just are refractionists, that we're just providing a pair of glasses and a prescription. What do we need to do to ensure that we change that perception and we don't fall into that trap?
Absolutely. I think we know that in both of our practices, we're dealing with a lot more than general routine eye exams. There's a lot of ocular disease. We have trauma that comes in. We have foreign body removals. We have acute infections, things that need care. And the reality is we're primary care providers. We are essentially like a family doctor for your eyes, is how I like to consider it. And I think our patients know that. The ones that come into our offices, they've established a level of trust with our training and care over the years. But maybe we have to expand beyond our existing patient base, talk to the rest of our healthcare community, other family doctors, hospital-based practitioners, and really tell them what we can do, right?
I think part of the issue is we do these things day in, day out. Like you said, foreign body, acute infections, walk in for whatever red eye type issues, injuries, all these things. Because we just do it every day, we just get used to it, and we don't realize that nobody else knows that we actually, outside of our office and our colleagues, the public doesn't know, MLAs don't know, our friends don't know. When I tell my friends I pick a piece of metal, I use a little algae brush, but I'm trying to think of the other, like a Dremel or whatever tool those things are, right? When I tell people I have to use these little tools to dig pieces of things out of people's eyes, they're shocked every time, right? And it's because we just forget that other people don't know we do these things. It's on us again. Let's go tell people it's cool that we do these things, right? And we just get so used to it.
Like you're saying, I think we do it in our practices. Our patients know that we care about, but everyone else, they don't know.
Yep, that's it. Any other things we want to share with our friends and colleagues out there about the importance of this conversation?
I think now is really the time in BC. We have new healthcare regulation with the HPOA coming into effect. And really it's a new world for regulation in healthcare for the allied health groups and healthcare in general. So I think in this new world that we're going into, we have to definitely advocate, and now's the time to take action.
Yep, absolutely. Now's the time. There is no time but now, right now. And thank you to everybody who's listening and watching to the 2020 podcast, Canada's #1 optometry podcast. I'll see you in the next episode.